Hello everyone, I'm Sonia Angelin, Associate Professor, Department of Life Sciences, Christa Jayanti College. In this video, we will be discussing about in vitro fertilization in human. In vitro fertilization is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. During IVF, mature eggs are collected from the ovaries and fertilized by sperm in the lab. The fertilized egg or embryo are transferred to a uterus. One full cycle of IVF takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer. IVF is the most effective form of assisted reproductive technology. The procedure can be done using the female eggs of own person or the partner's and the partner's sperm. Or IVF may involve eggs, sperms or embryos from a known or anonymous donors. In most of the cases where a gestational carrier can also be used, where a woman who has an embryo implanted in the uterus might also be used, such as surrogate mothers. Chances of having a healthy baby using IVF depends on many factors such as age and the cause of infertility. In addition, IVF can be time-consuming, expensive, and invasive. If more than one embryo is transferred in the uterus, IVF can result in pregnancy with more than one fetus. Multiple pregnancies can also occur. Common reasons of IVF are male infertility, unexplained fertility, ovulatory disorders, tubal diseases, endometriosis. And why is IVF done? So in vitro fertilization is mainly done for infertility reasons or genetic problems. If IVF is performed to treat infertility, less invasive treatment options can also be opted, where medications can be given to increase the production of drug, or intrauterine insemination, a procedure where the sperm can be placed directly in the uterus, can also be done. Sometimes IVF is offered as a primary treatment for infertility in women over the age 40. IVF can also be done due to certain health conditions. It involves several steps, which are ovarian stimulation, egg retrieval, sperm retrieval, fertilization, and embryo transfer. One cycle of IVF can take about 2 to 3 weeks, and more than one cycle can be required for a successful IVF treatment. These are the steps which are involved in a regular IVF procedure, where first step involves stimulation of ovaries for more egg production. Then egg retrieval from the ovaries will be done, and the same day fertilization of eggs will be done. Following that, the embryo culture is maintained from 0 to 5 days, and then the freezing of excess embryos will be carried out. Further, once the embryo is mature enough, embryo transfer is done, and on the day 14th after the embryo transfer, pregnancy test will be performed. The ovulation induction is the first step of the IVF treatment. In the couple's own eggs are used during IVF, the process of ovulation induction will be done, where they try to retrieve more number of eggs rather than the one single egg. The medications which are used for ovarian induction are medications mainly stimulate the production of eggs by giving hormonal injections of follicle stimulating hormone and luteinizing hormone. It can be given as a combination as well. Medications for oocyte maturation are where the hormone human chorionic gonadotropin is administered for maturing the oocytes. Medications to prevent premature ovulation, where they have to keep the maturing egg safely, and it is to be prevented from being prematurely ovulated. Medications to prepare the lining of uterus is also used, mainly when the uterus has to be prepared before the embryo transfer is done, where progesterone supplements are given to the female who are going through the process. 1 to 2 weeks of ovarian stimulation is needed before the eggs are ready for retrieval. To determine when the eggs are ready, the doctor will be performing a vaginal ultrasound to monitor and check if the eggs are mature enough in the follicles. Blood tests can also be done to understand if the follicles are carrying the mature eggs, where they will be monitoring the level of hormones in the blood. Some reasons why IVF can be cancelled is if there is inadequate number of follicles developing, if there's premature ovulation, and if too many follicles are developing, it can also be harmful for the IVF treatment, and the doctor might decide to cancel the IVF and carry on with another cycle later on. Egg retrieval is a process which is done after the ovulation stimulation. Egg retrieval can be done in a clinic where after 34 to 36 hours after the final injection of the ovulation injections. During egg retrieval, the donor will be sedated and given a pain medication. Transvaginal ultrasound can be done, and this will be also monitoring the maturity of the eggs and also to understand if the follicles are carrying the mature eggs. A thin needle is inserted into the vagina, and that will reach the follicles to retrieve the eggs. If ovaries aren't accessible through transvaginal ultrasound, then an abdominal ultrasound can also be preferred for injecting the needle into the follicles. This procedure might take around 20 minutes to collect the mature eggs. These mature eggs are further placed in a nutritive medium, and then they are incubated for further maturation. Eggs that appear healthy and mature will be mixed with the sperm to attempt to create the fertilization process. Sperm retrieval will be done on the same day of egg retrieval, and the sperm will be collected from the male partner, or a donor sperm can also be used, and this will be added in the laboratory. Fertilization is the procedure where the sperms are mixed with the mature eggs, and this can be done in two ways, where one is conventional insemination, where healthy sperm and mature eggs are mixed and incubated overnight, and the other one is intracytoplasmic sperm injection, which is ICSI. It is where a healthy sperm, a single sperm, is directly injected into the mature egg. Fertilization will be allowed to happen overnight, and the fertilized embryos which are ready will be transferred into the mother's uterus on the day when after the fertilized eggs are mature enough. And also they try to do a pre-implantation genetic testing to avoid any genetic problems. Embryo transfer is done at the clinic, where it takes place 2 to 5 days after the egg retrieval. A mild sedative will be given, and the procedure is usually painless, although mild cramping can occur. The doctor will insert a long, thin, flexible tube called catheter into the vagina, through the cervix and into the uterus. A syringe containing one or more embryos suspended in a small amount of fluid is attached to the end of the catheter. Using the syringe, the doctor places the embryos into the uterus. If successful, an embryo will implant in the lining of the uterus about 6 to 10 days after the egg retrieval. Further, the processes are helping in finding out if the implantation is successful and if the IVF is taken place successfully, and which will result in a successful pregnancy. Thank you.